Hello, everyone. We're going to give folks some time to get into the room. And while they're doing that, making sure that everyone can see my screen and what's going on here. We are here to do the pelvic health physical therapy pre-op, right? So trans care for pre-op body alignment and hormones. Hormones is one of the number one questions that I get asked on. Don't worry, we are going to go through them, I promise. But we're going to go through a few other things first. I'm going to give people just a few more minutes, just like a few more minutes, but they should all be here by now. So have your questions ready. You can put them into the chat. You can email to us later if something comes up afterwards, but this is a space for you to ask all the questions. There are no dumb questions. All the questions will be answered, I promise. All right, we'll go ahead and get started. Let's see if my technology wants to cooperate with me today. Oh, there it is. Okay, so I like to just give you an idea of what we're going to be doing. Table of contents here, right? A little bit about me. Hi. Talking through some clothing and things like that for our transgender, non-binary, gender diverse folks. And then non-surgical procedures, surgical procedures, and then hormones. I save hormones for last because I know y'all are going to have questions on it. And it's cool. I got you. Okay, so one of many disclaimers that I'm going to give you. This one is just in the fact that this is not medical advice. I am not your therapist, unless I am your therapist. But I do want to make sure that you know that this information is educational, that if there's anything that you feel pertains to you, go back to your provider and they can help you with that. So that's one of many that you're going to get, okay? Another another disclaimer that I'm going to give you is that the words, terms, terminology that I use is within my vocabulary, okay? And if it's something that you don't agree with, I'm okay with you being like, hey, we don't use that word anymore. And that may be the case, but it is 2024 right now. These are the words that we're using currently. And if there's something that you may not like, please tell me, but also understand that nothing here is to offend anyone. So a little bit about who I am. I am Dr. Sha'Rose Arian. Just go by Dr. Sha'Rose. I am a pelvic floor physiotherapist, which is pelvic floor physical therapy for our folks here in the US. I am an Australian trained physiotherapist in theory through the university I graduated from, but also in practice through an internship in Australia that I did during my schooling. And I am the owner of Rose Pelvic Physiotherapy located in downtown Huntsville, where we offer in-person visits as well as virtual for anyone around the world in the country. And our biggest thing is make sure people feel safe and affirmed in this environment while you can ask all the questions and you can, get all the information that you need to really help yourselves, but also make sure that you're feeling good, moving good, and doing things we want to do. That's me in a nutshell. I am a mom of two. I have two little ones. I'm a wife. I am a bisexual woman and the loved one of a transgender person. So the things that I say are not only from the research that I've done and the education that I've received, but it's also from personal experiences and then clinical experiences. And so I bring all of that together into this webinar for you to enjoy. So enough about me, though I could talk about myself much, much longer. Let's get into some of those things that you really came here for. First thing we're going to start with like clothing type things, okay? Binding, tucking, and packing. Those are the three kind of top things when we're thinking of the trans, gender diverse, non-binary population, okay? And there are some ways we should, some ways we should not be doing those things. All right, starting with binding. So binding is reducing the presence of breast or chest tissue, okay? One way to kind of think of that is like helping to decrease the appearance of a breast or a chest, right? That can be done using compressive garments. It can be done using tape. There are some ways that we shouldn't be doing it. So let's talk about some do's, right? How should we bind? This is typically for our trans masculine or female to male, right? Individuals. who don't want as much of a presence in their chest. But things that we should be doing, right? Using proper binding materials, okay? So things like duct tape are not appropriate. Things like saran wrap are not appropriate. We want to make sure that we're using binding tape made specifically with the idea that you're going to decrease tissue in the chest. Trans Tape is a company that they make tape specifically for binding compressive garments, like actual binders. Some of them can just be like, just a chest part. Some of them are full body, so they look like tank tops. And then you could also use sports bras, have been used before, to help decrease the volume within the chest. So there is a proper way, though, that we want to bind, because if we don't, we can restrict blood flow, we can restrict breathing, we can restrict rib cage mobility, and all of that can really make walking, sitting, standing, that type of stuff really uncomfortable. So when we're talking about binding with tape specifically, there's a question that came in here, and I'm looking over because this is the other screen that my questions pop up on for me. Is there a method to consider when using tape for binding? And there is. So when you're doing it, you want to make sure that you're taking the tissues kind of from center to kind of downward. And you also want to put a piece of tape over the nipple facing outward. So you don't want that adhesive to be pulling on your nipple when you go to remove it, okay? Because that's going to cause some skin damage and things like that, okay? So with taping, you do want to make sure your angle is going more down towards the armpits area, but also having a spot on there that covers the nipple so you're not getting any skin concerns when we're removing it. We're going to talk a little bit about removal too. I'm sure somebody's going to have a question on that. But all right, another thing we do want to do is take a break from wearing your binder every 4 to 6 hours. Some people say 6 to 8 hours, but anytime we're compressing, we're really pushing down on tissues, you want to make sure you're taking a break from it so that your body can kind of come back, ribcage can open, and you're able to expand a little bit. So you don't want to be in it for far too long. The other side of that is definitely stretch your body, stretch your shoulders, and stretch your chest. Okay. This is where pelvic floor physical therapy comes in at, right? Getting that chest open. So if you're taking that binder off, you want to be able to open the chest up and breathe. You want to stretch up into your neck. You want to get the shoulders moving. Okay. These are all very important things to do as you are even in the binder a little bit, but definitely once you've taken it off. Okay, a couple things we definitely don't want to do. Don't exercise in the binder. That is going to be not good for your body. Okay, so if you're exercising, thinking of things like running or doing any weightlifting, while those may be public facing areas, you don't want to exercise in the binder because, again, when you are asking your body to take on a bit more effort and exertion, you want the rib cage and your breathing to be able to expand to the volume that it needs to. If we're compressing it, we're not going to be able to really expand. And also, we're not going to get the full access to some of the muscles either. So you think of if you're doing a back day, but you're wearing a binder, you're not getting the full access to those back muscles if you're trying to work out within that binder. So that may be a time to do something like maybe use tape or a sports bra, something a little less compressive to help with that. Another do not wear your binder to bed. Absolutely understand gender dysphoria can happen, especially if we're talking about chest tissue. So finding other ways to help be compressive, maybe tighter shirts or something like that, but not wearing that binder to bed. Because one, if you're getting the proper amount of sleep, which I absolutely hope that you are, you should be getting 6 to 8 hours of sleep at night. And that is too long to be wearing your binder anyway. And then, of course, it is compressive, and our body's goal at sleep time is to be able to rest and rejuvenate, and you want to have full ability and breath to be able to do that. So now, tape is very, very important. This is something that I tell folks with removal of any type of tape that we use on the body. So if we're talking about like K-tape, kinesio tape, pregnancy belt, all of that stuff. When we're removing tape as a binding, you want to get it completely soaking wet, okay? And or use oil to remove it. Skin is a huge problem. Like, we want to make sure your skin is well protected. So you don't want to just rip it off like it's a Band-Aid, even if you do have your nipple protected, because you have other tissue that you want to, not irritate, especially if you're binding consistently. So if you're wearing tape or a binder every day, you definitely don't want repeated irritation, because then you might get in a space where we have infection or where you won't be able to bind. And so if we do it properly, then we can do it longer, for as long as we need to, throughout however long your process may be. So that is one thing, making sure you're removing it properly. So just getting it soaking wet, using oil, and doing it slow, not ripping it off like a Band-Aid, but also giving yourself time outside of that tape, also for your skin to recover. Okay, so I know there's probably some questions I didn't answer, so drop them in the chat for me if you have any other questions on binding. Okay, so we're gonna move on to tucking. Okay, so this is something that our trans women or our trans feminine folks may do. The tucking is the reduction or reducing the presence of genitalia. Okay, I'm gonna use terms here: penis, testes, testicles, scrotum, right? Whatever words that you use or you've heard that is appropriate for you, I completely understand it and validate it. But just for the ease of this webinar, we're going to use those terms. So reducing the presence of, let's say, a penis print in your pants or shorts. So some things we do want to do. Oh, we have a question. Okay, let me start. This is a good one. Is tucking safe? Okay, beautiful. First of all, also, as I'm saying this, I realize that I don't enunciate very well. So any closed captioning may make this that's not a bad word, but anyway, I just realized that. But is tucking safe? I'll enunciate a little bit better during this slide. It is safe, okay? I'm going to talk through a little bit more after we get through some of the do's and don'ts, but tucking in general, short answer, yes, it is safe when done properly, okay? So some of our do's: we definitely want to use appropriate material. That's going to be across anything that we're doing for the body. Like, we really want to use appropriate material. So think of medical tape, right? A gaff, right? A gaff is where you are able to have a smooth appearance. You can pull that up over your genitalia, and then you have a smooth appearance that is there in the print instead of any type of genitals. And then, of course, on underwear, right? You don't have to use tape in order to tuck. So if you're irritated by adhesive, or there is just uncomfortable, there are ways to be able to tuck without using tape, and we'll talk a little bit more about that. But you want a really supportive pair of underwear, okay, that are going to help make sure that you are keeping things supported. So use appropriate material. The other thing is, do start with your testes. Okay, so the proper way to tuck: you want to take the testes, which are the two balls. Okay, we're adults here. We're all adults. The two balls, and you want to take those and kind of push them up into their socket. Right, they have a natural space that they go into. You want to push them up there. You'll be left with the scrotum. Okay, so then you're gonna take the scrotum and then penis, and you're gonna tuck those all back. So that's how you're gonna get the space in order to be able to tuck, okay? But you wanna start in that process, because that gives you the most space and comfort when you are doing things. Now, once you have testes pushed up, scrotum, and then penis, then you want to take some tape, and then that's how you secure it. However, if you use a gaff, you can do that. Or if you're just using underwear, you can also do that. When you're just using underwear and not using any tape, there may be the ability for things to slip out, depending on any activity you might be doing later. So you should be able to hold, things tucked for a bit without tape, but there is that difference there. And then if you are using tape, you want to consider removing any hair prior to taping. Just think of it like a little wax. It can be your bikini wax, but you want, because what's going to happen, right, is you have that hair that's present there, and then when you go to remove it, even if you're using water, you got it. Not even if, since you're going to be doing that, because I've already told you that's the best way to remove tape. You still have hair that may just not handle it very well. So consider, doing a shave, or I'm not a huge fan of waxing, but it could be beneficial before you do the taping. All right, some things we don't want to do. Don't force the genitals to move, okay? Be very patient and kind to your body. So if the penis is not wanting to move, if the testes are not wanting to go up, scrotum's not stretching very much, don't force it, right? You can do a little bit at a time and reduce the presence of your genitalia, but you don't want to be in pain, okay? That's one of the biggest things, is we want to be able to be comfortable, okay? So that goes into my other one. Don't push through pain or discomfort. Slight discomfort, normal. Pain, not normal. And we stop. We untuck, we try it again, a different process. We're not pushing through pain, and we're not pushing through discomfort, right? And we're not forcing the genitals to move, right? So all that to say, is tucking safe? Yes, it is safe, because when you're doing it properly, you're taking into account all of the other things that might go into it. Also, tucking can be really important if you are considering doing any type of bottom surgery or vaginoplasty later, because tucking actually does provide a little stretch to the tissues, and it gives more laxity to that space. So if we're looking at any type of vaginoplasty later, it actually is very helpful to tuck, as long as it's done safely, okay? Like any pain or discomfort, we're stopping. Another question that came in is, will an erection during tucking cause it to be untucked? Which I hear you, right? You are doing something, you're out, arousal happens, you get an erection, and now you're concerned on whether or not things are going to become undone. No, okay? Typically, no. If you've gotten things pretty secure, it's not going to. It may be more uncomfortable, so you might really have to work on some things that can help with decreasing erection, but it should not come untucked, okay? Let's see. Another question, can tucking work for larger penis or smaller penis sizes? Yes, they can. You may have to do, okay, let's talk about penises that might have a bit more girth, right? So a larger penis size, a little bit more girth. You may have to kind of tuck in a little bit more, or you may have a wider kind of space going there. But tucking can be perfectly fine for someone with a larger size, and also someone with a smaller size. So say scrotum isn't as large, or say penis isn't as large and the scrotum may kind of cover more of it. That is perfectly okay, as long as you're taping appropriately. Smaller size won't be a problem either. But that is definitely something, again, going back to like if you're going into any type of further procedures, surgeries, vaginoplasty, that smaller size, getting a little stretch on it may help with ability to create a canal later on. So that is something to consider. All right, if you have any other questions on tucking, please drop them in the chat, okay? We're gonna move on to packing, all right? This is something that, again, I say our trans masculine folks, female to male, but any from packing, tucking to binding, any of our folks could be using any of these methods. So we don't ever want to assume. But the purpose of this is to increase or create a presence of genitalia. So thinking of having that flat surface and we want to have a bulge, right? Some bulges may be bigger than other bulges. That's okay. Things that we do want to do, right? We want to clean the material regularly. So doesn't matter what you're using, you want to clean it regularly. That means if you're using something like in the picture where you have a harness and you have a soft packer, right? You want to make sure you're cleaning because the body, the body makes odors and it makes bacteria and things like that. And you don't want that to sit around any of our genital area. Okay, we want to clean it regularly. One way to do that and to keep your privacy, depending on where you live or who you share a home with, is to do it in the shower. So you can use a soft cleaner while you're in the shower. And then that way it's not an outside task, right? That you might have to do at a different time and be more concerned about privacy. The other thing is consider using a Santa pee packer, right? Those are sold separately. They look like a little funnel. They have different shapes, but for the most part, they look like a little funnel and they have just like a space to scoop here to kind of cover the full, again, vulva of, yes, of anyone who has a vulva. So we'll cover that full space and then you can stand and you'll pee, but it'll have a stream there. That could be helpful, like if you're in public and you don't want to remove the packer, right? Or you want to try to use a urinal, or you just, it can be very affirming, right? To reduce dysphoria. Do ensure your packer is secured properly, right? What we don't want is that you've got this bulge that you're comfortable with, and then there's these concerns of it maybe being a little bit more to the left or to the right. Now, typical genitalia does move, but we don't want it to be an obvious shift, or we definitely don't want it to come down your pants leg or down your shorts, right? We don't want things like that. So make sure we secure it properly. You could use things like tape if you want to, but really having boxers or boxer briefs that have a little pouch that you can allow for things to go into is perfectly fine. Also, let's get into some don'ts. Don't overthink what can be used. Some of the very first packers that folks start with and cost efficient are socks. Okay, you take a sock, you fold it over, and that can give you a nice bulge. And then you just place that into your underwear or boxers, and that can be great going forward. That's a good starting place. If that's something that you're comfortable with, you don't even have to move from there. But then you also have, soft packers that you can buy from companies, as well as hard packers, right? Those are ones that aren't as flexible and bendable and come in different shapes, but you can also use a harness for those as well. And then same thing again, like don't push through pain or discomfort. So if you are using a packer and it's maybe a harder one, or you're using a harness or something like that, definitely don't push through any discomfort if you're noticing it. If it's creating bruises or anything like that, we need to rethink how things are happening. Okay. Now, drop any questions that you have in the chat for me. I don't see any so far, so we're gonna keep going. All right, so those are the three major, packing, tucking, and binding, right? Those are affirming activities, right? And ways for tissue and genitalia to be present or to be absent. I want to go into some non-surgical procedures that are still affirming as well. So biggest thing here, right? Psychosocial therapy and counseling. Listen, you typically will not go through much of this process without having talked to a mental health provider. One of it is just like it's by law, by all types of standards of care. Having someone to talk to and or get resources from, support from about what is going on either in your life, in your body, all of that is super important. I shared on the very first webinar that I have my mental health therapist. I have a lot of folks around me who are mental health therapists, but also I pay people to help me. Anyway, I'm a big proponent for mental health. So psychosocial therapy and counseling is a huge part of affirming care. And then it is a procedure, right? Because it's your mind and your brain and your body that you're working with. So what it may consist of is some talk therapy. Some people respond really well to that. And therapists have become so much more accessible. I say that in quotation marks because therapy they can have backlogs and things like that, but they're now virtual, which is nice. Okay. Because if your barrier is getting up, getting in a car and driving somewhere, having the ability to do virtual sessions, some of them do text messaging, some of them do voice calls. It makes it so much easier. That barrier is just removed there. The other thing it can consist of is education. Like, one, educating on how this process might look for you, or how it has looked for other people that have gone through the same type of steps, right? So if it's like starting of hormone therapy or starting of changing your expression, your gender expression, how do I wear, the clothes that I want to wear? Education on that stuff is huge because these therapists have seen it before. Advocacy. Sometimes you don't even know what you got to advocate for. Like, how do you know that you need your doctor to increase your hormones, right? If you didn't even know that it was something that you could say or should. So sometimes being able to advocate for yourself, or maybe you know that stuff and you're just like, I have no idea how to ask this, or there's so much pressure around it. And so being able to advocate for yourself and know what to do, that could be part of therapy as well. Letter writing, that's probably the biggest reason folks are, talking to mental health providers. However, it's an important one. So WPATH, in their most recent standard of care 8, I believe, came out, and they did change some of the surgeries and procedures and things like that require a letter to be written by or from a mental health provider. So sometimes it's a psychologist, sometimes it's a psychiatrist, sometimes it has to be a doctor of either of those. And so the requirements around letter writing has changed. Now, of course, sometimes it's because of insurance that things are still requiring those letters to be written. But that's a huge proponent of why psychosocial therapy is important, is because they can write those letters of support to say that, yes, this person is of sound mind and body and all those things to go on to this surgery, procedure, therapy, anything like that. And then, of course, case management. So helping you to managing, right, your health. So if you're like, okay, we have a mental health provider, but we need pelvic floor therapists, or we need some support as in housing, right? Those types of things can fall into the category of what psychosocial therapy and counseling can look like. Drop your questions for me, okay? All right, but here are some additional non-surgical services, okay? Laser hair removal is huge. Where I am, there's like, I don't know, 3 laser hair removal people. And when I honestly like one, frankly, there's only one who is truly open because the backlog is so long and the appointments are like 3 months out at sometimes. Like, but once you get in, you're in, but it takes a minute for you to get in. So laser hair removal can be used for many reasons. So if there's, we'll talk a little bit more about this when we do our post-op, post-surgical webinar, but laser hair removal can be used for surgical reasons. So if we have any transmasculine folks, they can use it for donor sites. So say they're going to do any type of phallus creation, donor sites might be on the arm, legs, it could be on the stomach, it can be on the back. So they want to remove that hair because if you're going to make a phallus or a penis, you don't want to have hair on it. But also it can be used for our trans feminine folks for surgery for vaginoplasty. Same thing. If you're going to have a vaginal canal, you don't want hair in it. Some people, however, decide that it doesn't matter to them. And so they don't do laser hair removal, but sometimes it's the surgeon who requires it as well. But then, of course, laser hair removal can be used for things outside of surgery. So if you just want You know, if you're a person who has a lot more hair than other people, you want to have that removal for a more feminine look or feel, right? Voice training is huge. Frankly, I could probably use some voice training myself. One, because I talk a lot and then I just sing very loudly all the time. Anyway, but voice training actually can be used for folks to help higher their pitch, like bring their pitch up, or lower their pitch. When we think of voice and how we're identified through our voice, sometimes it can be very dysphoric for someone to speak either on the phone or in a place where someone can't visibly see them. And so they may get misgendered or misidentified because of their voice. So voice training is a very important non-surgical, okay? So voice training is usually done by voice therapists who specialize in the specific ranges that are within normal or that a person may be trying to get to. Now, there is a surgical vocal procedure that can be done to help folks as well, but voice training is a non-surgical way. Social transition, of course, in making sure the people around you are affirming, making sure your appearance is affirming. So social transition is another way. STI testing, knowing your status, being aware what's going on, that is non-surgical. That is something that everyone should be doing, regardless of if you're in a committed relationship or not. You want to know whether there's any type of STIs, formerly STDs, going on. Okay. Dermatology care. Oh my goodness. If I could get into a dermatologist, they are booked too. I don't know what it is about these specialists, but dermatology care is a very important one because there's so many skin changes that can happen, right? We're going to talk about a little bit more on hormones, which I know you're on the edge of your seat. So we'll get to them. I promise. But dermatology care is a big part of it. Think of you're taking hormones and now you have acne that you've never had before. Or maybe you had some, but now it's more than you've ever experienced. Or your skin is super dry. Dermatology care is important, but I don't think folks understand that that can be a referral or that can be a part of the process as well. Fertility care, right? And this can look many different ways. This can look like freezing eggs or freezing sperm. This can look like IVF or IUI. Unfortunately, I'm not going to get on my soapbox, but the things that have happened with Roe v. Wade have actually had an impact on fertility care for many people outside of our trans and non-binary individuals. Here in Alabama, actually, the fertility clinics have ceased, they've stopped their IVF care sometimes, and some people were even in the middle of cycles. Anyway, getting off that soapbox, but fertility care is a part of affirming care and being able to know your options and being able to preserve fertility if you want to or not. So that's the choice that you have. And then, of course, pelvic health, huge non-surgical way to take care of your body. Okay, I could talk on this for days and days and days. That's why I created 4 whole webinars on it. But it is a space where you can do, it can be internal, where you do exams and you're inserting things, or it can be purely external. But anything that you're having done and any procedures that are happening to the body, being aware of your pelvic health, and now pelvic health includes, it's not just the vaginal area. It's vagina, vulva, rectum, it's the stomach, it's the hips, it's the back, it's the chest. I would say it's the whole body. It really is. However, those all go into it for just the center of our body. So those are just some additional, okay? So let's get into some surgical procedures. Now, I have a whole webinar that's going to be on post-op. So we're going to go through each of these things that you're going to see and talk about wound healing and scar massage and things like that. So this, again, is a glimpse of what surgical procedures could look like. I also forgot to say, if you had any questions on some non-surgical procedures, please drop those in the chat. And because we want to make sure we answer these questions and we have the space and the time for it. So let's talk a little bit about the pelvic floor. This is my spot. This is why I didn't get on my soapbox earlier, because I was like, I have a space to get on my soapbox about the pelvic floor. Okay, because this is just a small glimpse. And these are, the traditional binary idea of male and female anatomy. Okay, we do have our intersex individuals who exist, and their anatomy can look different from this, but this is a typical binary depiction of it. And so always, always, always asking and answering, what's the pelvic floor? You know, we talk about this all the time, but like, what is it? And this is a great example. So the pelvic floor in general, it is a combination of your muscles, bones, ligaments, tissues, and organs. All of that stuff down inside of your body, okay? And so if you look on your left, right, you see the muscles, or you see the organs, okay? You have the bladder, you have the prostate in the male anatomy, you have the rectum, okay? And then, of course, the urethra goes down. And so when we're talking about pelvic floor health, we don't just talk about the muscles and the tissues. We're talking about the organs that exist there too, because they have tissue around them that also impacts what's happening in those other areas, right? And so if we look at the traditional female anatomy, right, you have the bladder, the uterus, and then you have the rectum, okay? And so those kind of sit there. Looking at the muscles, they're color-coded here for you onto your right. And honestly, I'm not going to go through all of them. Some of them, I try to say the names of them. They're not important in the sense of knowing the specific name of them, unless we get to like surgeries and things like that. Because when you look at like the typical male anatomy, right? If we're removing the penis and things like that, and we're inverting things, we have to create space somewhere in these muscles. So that means ligaments and tissue is being cut in order to create that space, because it doesn't, typically have space for that, right? And then, of course, when we're looking at the female anatomy, we're taking away space. So if we're talking about any type of bottom surgeries and we're taking away space, but we're removing the vaginal canal, well, then now we have to bring tissues together that aren't supposed to be together, right? Either of those situations can cause any type of restriction and tightness or pain. And so pelvic floor physical therapy addresses that beforehand. Let's look at any tightness or anything we have in the pelvic floor, but then also let's look at it afterwards to see what, exists, because also we know some typical healing things to expect. So when we say, what is the pelvic floor? It's everything. And this all attaches to your hips, to your back, to the knee, it goes all the way down. So the abdomen, the chest, all of this has an impact on it. Okay, so good types of surgery, as I promised you. Drop any anatomy questions for me. I love talking anatomy. All right. I spent a whole lot of time learning that anatomy. Trust me. So please. If you did our first, not if, because I imagine all of you have been in for the whole time, but if you did this, the types of surgeries, this is probably familiar to you from our first webinar, because it's the same slide. But all that to say, this is going to give you a nice little overview. So chest reconstruction or chest masculinization, top surgery, right? So that's that removal. So someone who might be binding is trying to decrease the tissue there, and having the surgery will, decrease it for them permanently. And then they can no longer, or they will no longer need to wear a binder. We look at things like hysterectomy, that's with or without oophorectomy, right? That's removal of the ovaries. But hysterectomy is removal of the uterus. And like we said in that previous slide, right, when you start removing stuff from the body, integrity does become a concern, okay? Metoidoplasty, that is a type of bottom surgery where you create a phallus. It's usually going to be shorter and not as girthy as a traditional phallus, because you're not adding any tissue. You don't have a donor site. You're lengthening the urethra. Sometimes folks choose not to do that. And so you're going to get a smaller but a much longer than anatomical phallus. And then phalloplasty is the actual creation of a phallus through a donor site, which can be from multiple places. And then lipo in sculpting is being able to remove like traditional fatty tissue or areas that may have a little bit more volume, and then sculpting it to have a more feminine appearance. Now, when we look on the other side, right, these kind of go hand in hand, right? The breast augmentation or feminizing. So that's adding tissue. So for folks who are trans feminine, adding tissue, breast tissue, orchidectomy, that's the removal of the testicles, penectomy, the removal of the penis. Now, these aren't typically being done like solo. You know, these aren't like steps in bottom or top surgery. So it's not like you go and it's like, okay, you know, we're going to schedule you for this removal of the testicles. We're going to schedule you for removal of the penis. And then, you know, we do the vaginoplasty. Usually this stuff is happening all together. Like I said, we'll get a little bit more into that later, but it's usually happening all together. But these are what they are. And then facial and neck feminization. So that can be the shaving in the face, shaving of, say, any forehead tissue, any nose tissue, any type of chin tissue. It can be the shaving of that to create a more feminine appearance, a more rounder shape. Same thing within the neck. So that can be the shaving of the Adam's apple oh my goodness, words. The shaving of the Adam's apple to present a more smooth appearance within the neck. And so these are some of the types of surgeries. But I'm gonna tell you, come back for our full, you know, dive into them, because these can look so many different ways. The first one I go to is like phalloplasty, because you have 4 to 5 locations that a donor site can be created from in order to create a phallus, right? To create a new penis. Vaginoplasty can look a tons of different ways too, and it's all based off the surgeon's, not all. A lot of it is based off of surgeon experience and preference on how things on sites and types, but also, of course, is based off of how you, the patient or person, would like to present, or, you know, so there are some variations to them, but I love it. This is just a quick kind of overview of what to pack in your bag for your gender affirming surgery. I'll go through this in so much more detail, but in a quick, you want to have gloves for sure. Some chuck pads, right? Chuck pads are going to be for any surface that you're on. You know, pads are going to be for any type of bleeding, because surgery, there's going to be blood. It's normal. Typically, you want a pillow, cushioning for the car, cushioning for, you know, any hard surfaces, because sitting after you've had any type of procedure or surgery on your pelvic floor may not be very comfortable on a hard surface or less soft surface, right? You want shorts or something loose, ice and ice packs. We got to keep the swelling down. A stool, because I am always going to ask about your bowel movements and how well you're pooping. A stool or a squatty potty is so important. Snacks, because you need to keep your energy up, but also you may not want full meals, so you definitely want to have like crackers or something like that. And then water, because you gotta stay hydrated. Okay, like that is the quickest way for your healing to go downhill fast, right? Not having enough water, not giving your body enough of a chance. We are going to go through this so much more when we're talking about wound healing and things like that, because man, the way that you prepare for your body to heal after surgery, it makes the biggest difference on your recovery. So these are just a few things to consider that are going to be separate. Your doctor's probably going to send you they're going to send you a list of, you know, the things that you need for recovery. But these are things that are not going to be on that list. Trust me, ask me how I know. They're not going to be on that list. And you don't want to be, you know, 1 to 2 days post-op and looking for gloves or looking for chuck pads or not realizing you need ice. Okay? So don't worry. I did it for you, so you don't have to do it. This is all here for you. Okay. Here we are, folks. Hormones. Because I know this is what you've been waiting for. So here we are. So hormone-related changes, okay? The number one question, right? What can I expect? When can I expect it? Is this normal for the time that I'm taking this hormone? All the things. And that's a valid question, because Yeah, hormones are wild. All right. We have hormones in our bodies from the moment we have a body, right? Hormones are how we even, function. And so when we start to add or decrease or, adjust, it really can have an impact on how your body changes, the things that you notice, how you feel, your mood, how you sleep, how you eat. Our hormones are so important for regulation of so many parts of our body. So it's knowing what is normal or abnormal is super important. Okay. So, right, if we're talking about female to male, our trans masculine folks, again, disclaimer on language, folks. These are words that are just a little bit easier for us to just make general. So, some examples of hormone medicine, right? When we're thinking about someone anatomically female who is born with female parts and or functioning, right? The menstrual cycle is a huge part of dysphoria, right? The thing that happens, can happen, and should happen every month can be a consistent reminder, right, of anatomy. So we can take estrogen-free birth control to stop the period, right? This is another disclaimer. I'm not your doctor. I am not a medical doctor. So that being said, if any of these medications or hormones seem like something that may be appropriate for you or you have any questions on them, these are definitely things to take back to your provider. Okay. But stopping the period is, after puberty, definitely something we want to do in order to just help with the affirming care, but also dysphoria. And then, of course, testosterone. Now, some people may not want to go the route of testosterone. Stopping the period can be the perfectly amazing, affirming, non-dysphoric space that a person may need to be in. And that may be it. It's not to say that any one way of trans and, gender diverse, there's no one way to be trans. And so if someone's like, I just don't want to have a period, that's the only thing that really bothers me about, this body. Beautiful. We got that solved. Now we can work on some other things that may be going on. But for the folks who that's not enough, we go into testosterone. And so there's a few different ways that it can be administered. You can take a pill orally, not available in the US. The US is like, we don't like it. It's not that way. You can do injections, and that can be big muscles. So think, thighs, if you have big thighs, glute muscles, shoulder muscles, usually where injections are happening at. And then there's gels. There's gel options. And so with each of those, there's pros and cons to each of them, realistically. And so you want to think, because when you think of a gel, if you're applying that directly onto a part of your body, if you're coming in contact with another person who shouldn't or doesn't need to be exposed to testosterone, that can be a concern. So you have to have a certain amount of time before you interact with somebody else. When you're thinking of things like gels. Injections, not usually as big of an issue, but you also have to make sure you have clean needles, clean and sterile needles, not reusing them. Then, of course, having the testosterone to be able to inject yourself. Things to monitor, okay? Because when we start doing hormone therapy, we have to monitor how the body is responding to it. And it can't just be like, I got the changes that I need or I wanted, or, how fast is it happening? It needs to be based off of blood work. So lipid levels, right? A lipid panel, making sure that your hormone levels are in an appropriate range for you. So sometimes folks will come in and they're just like, well, I'm in a typical male range of testosterone, which is great, right? But your estrogen level may be well higher than it needs to be. And so while your testosterone might be there, your estrogen is higher. So you're having a battle within your hormone, characteristics. So having full lipid panel, you need to know estrogen, you need to know testosterone, you need to know liver enzymes. Liver is huge because especially with testosterone, your body is having to process and, filter out these hormones, and liver enzymes, and also your heart enzymes are important as well, because those are things that are affected. So when we're looking at hormone related changes, the organ anatomy is very important. And if you don't have a provider who is monitoring these things, we need to get you in a place where someone is, and or say you're a clinician like I am, and someone is coming in and they're having these signs of maybe heart concerns or liver concerns, which we know how to screen for. It's something that we've learned in school. And if they're having something that doesn't seem muscular, but it seems organ related, they need to get those things checked as well, because hormones can affect your liver enzymes as well as it can affect the heart. So lab work monitoring, super important. But let's talk about some things, some expected changes, right? So hormones come in, right? We got testosterone, or, right, we have testosterone, or we just don't have estrogen, right? So say there has been a hysterectomy and you remove the ovaries, so now we don't have as high a level of estrogen, okay? So we got some changes. You're gonna get that redistribution of weight. So typical female anatomy, the weight is usually held a little bit lower in the body, around thighs, hips, glutes, things like that. So it's going to redistribute and may go a little bit more to the stomach, maybe a little bit higher into the belly, right? So you can expect that to happen. That takes some time, okay? But one thing that I know my transmasculine folks get real excited about is that increase in muscle mass, okay? Because that's when those gym pics start coming in. If there's any type of top surgery, you get the muscles and the pecs growing, okay? I don't have a whole lot of muscle mass. I don't care to. Genetics have been very well to me, but muscle mass, when that starts to happen, folks get very excited. Deeper voice is something that can happen, and being patient with the voice, okay? Because that can take some time. I know I keep saying sometime. I can't give you full ranges. I'm gonna be very honest. I can't, because it can take time depending on your body. And if you're doing any type of voice coaching or voice therapy, it can take a little less time, because you know how to properly lower the voice and be able to, get in the range that is comfortable for you, but also gives you the tone that you're looking for, right? Larger clitoris, this is one that most folks are really looking for, right? Because that larger clitoris can be closer to the anatomical male penis and can give you different sensations and pleasurable things. So larger, it can take a little bit, but it might not take that long. Honestly, that can be seen within a few months. But to be honest, it sometimes it may be arousal, like true arousal. So the clitoris itself, when aroused, can be erect like a penis. Okay, so what we want to make sure is that the clitoral size that you're seeing now isn't because prior to any activity you were having, you might not have had proper clitoral arousal, and that's what we're seeing, versus actual growth within your clitoris. Okay, so those are things to consider. Hair loss on the head, and hair growth everywhere else, so common, right? Male pattern baldness is very real. It starts to come in around the front, thin out a little bit. So you have this really nice hairline. Now suddenly it's getting pushed back a little bit. I hear you. It's real. There are some other hormone therapies or other procedures that you can do for hair. If you want to keep, your hair and your hairline, I feel you. Why not? But you can also go bald, and I think a bald head is very nice. But that is like, it is something that you can expect, is hair loss might happen, especially if genetically you have a parent or someone else who had experienced hair loss. But you also get hair growth everywhere else. So if you didn't have a hairy back, you might start having one, or a hairy chest, or hairier arms, or hairier legs. And that's also pretty normal too. And that doesn't take very long to start happening, that hair growth to come into place. So if you don't like hair and you like that smooth look, which, some trans masculine guys do, and just some guys in general do, then for sure look into hair removal and things like that. Here's the thing, okay? Body odor is going to change. It's hormones, okay? That's just normal hormone activity. So if you think of a time like, I don't know, puberty where you suddenly have these hormones that come in and now you have all this sweat that's coming and all those things, body odor is going to change. It doesn't mean you're more gross, I promise. It just means that the deodorants or the soaps or things that you're using before may not work with your body chemistry where it is right now. Okay, so we just got to shift it. I don't know, right? For myself, I have to go through, I wear natural deodorant. You can have your opinion on what that means, but because I wear natural deodorant, sometimes it stops being effective for me. Summertime deodorant and wintertime deodorant are two different deodorants. My chemistry is different, and so I find that out very quickly. And so that's a very common thing that just naturally our body goes through cycles. And so don't be surprised if your odor changes a little bit. And then oily skin or acne, right? Because now you can think of it as like a second puberty or first puberty if you never went through puberty. And your body is learning how to manage these hormones. And oily skin is definitely part of it. So making sure you have a skincare routine that isn't going to dry out your skin either. So our goal isn't because we have oily skin that we just try to dry it out as much as we can. We wipe, 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 wipe. Dermatologist may be an appropriate person to reach out to, okay, to properly address it. Because we don't want to, solve one thing, but cause another, right? Solving the oiliness by drying out your skin and causing microabrasions isn't going to be the answer. But we have to keep that in mind. Also, with any type of hormone changes, replacement therapy, realistically, it takes your body about 12 months to adjust to a change within the hormones. So that means if you started at say you started at however much of an injection for testosterone, and then maybe 2 or 3 months later, realize it wasn't quite enough or we need to adjust it, from that 2 to 3 months later, then we're going to see kind of over time how your body is going to adjust to that change. So about 12 months is how we can expect your body to regulate itself with consistent care. Okay. Drop your questions. Let me know what things have come up for you. Because listen, hormones, I can tell you, it's a big one. All right, so let's go to our male to female, right? Our trans feminine folks. So we think of, and a slide that I had in a previous webinar, right, was that a trans feminine person or a trans masculine person could be taking estrogen, could be taking testosterone, because sometimes the solution to any of these changes could be, hey, we need a little estrogen cream, right? So don't get stuck into this mindset that a trans feminine person needs this or a trans masculine person needs this, because we cannot know. Any person, non-binary, gender diverse, any person could use estrogen or testosterone. Okay, so looking at hormone medicine, right? Let's see. Wow, my brain just completely lost my hormone medicine for our trans feminine folks. Anti-androgen, right? That's going to be you can call it a puberty blocker, but really what it is a hormone blocker, okay? Because it can be used for male, female, anyone in between. And it is just kind of like the stopping of a period. It stops that hormone presence, right? And then estrogen, there's oral estrogen injections and then a patch, right? They do have gels too, but usually what you'll see folks do is a patch. That's the most common way for people to get estrogen administered. And then same thing though with monitoring. Blood work is going to be a huge part of it. Now, your doctor, and so this is like either a surgeon, your primary care, any internal medicine, any gynecologist, urologist, right? Your medical team consists of a few doctors, a good bit of doctors, and all of them should have an idea of what your hormone balance and panels look like, because it does affect all that you're working, all that you are working with, all the people that you are working with. So prolactin and triglycerides, right? You want to monitor those, right? Those are going to be, we say prolactin, right? Those are like those lactation type of hormones, but really it's the traditional feminine, right, idea of what we think our hormone panel will look like. So you want to monitor that. You want to monitor your estrogen levels, because exposure to too much estrogen is where we get the risk of cancers and things like that. So we don't want the levels to be way too high, but also we have all the other fun things that come along with estrogen, and that can be like mood swings and hot flashes, all of that stuff. We don't want that. And then if you're taking a very specific type of medication, potassium is going to be a big one. Okay. But again, these are all general panels that you need to be tested for. But of course, liver and heart enzymes too, because very important. Okay. All right. So let's look at some of the expected changes. Redistribution of weight. We talked about this, right? So say we have a traditional anatomical male body. Now the weight might go a little bit lower than it was before. It may go to the thighs, it may go to the hips, and it may go to the breast tissue, okay? That is a normal expected change to kind of fill out around the mid part of our body. Breast growth is a part of it, which is sometimes great for folks, right? Sometimes folks don't want that. Here's the thing, we can't quite control, okay? This is very important. You can't quite control the changes that happen when you start hormone therapy, right? We can adjust for as much as we can adjust for, but your genetics are going to determine what may be presented when you expose your body to more of a hormone. So same thing with male pattern baldness with the exposure to testosterone. Same thing with, chest and breast growth with exposure to estrogen. So if genetically your body with more estrogen in it creates larger tissue, that's going to be what's unlocked with hormone therapy. So we can't really control that. Sometimes though, not as much happens, right? You may be like, "Ooh, I'm about to have these big old chests," right? And that might not be genetically something, all the other cis females in your family may not have big chests either. That might just be genetically where you fall within that realm. So hormones are not going to unlock anything within your genes that are not already there. Okay, I hope that makes sense. Let me know if it doesn't. Just keeping that in mind when we're talking about expected changes. Loss of muscle tone, right? Because unfortunately, we don't have these big old ginormous muscles, right? You have to train those and train a little bit differently for cis women. Then thinning facial hair, okay? That is not a problem typically, unless you like your facial hair. Then we have to find ways to keep it there for you. But thinning facial hair is something you can expect. Fewer and smaller erections. This is a very big part of it. So arousal changes with the increase of estrogen. It can change with the increase of estrogen. Same thing with fewer and smaller erections, where like they may not be fully erect, or you might have them less frequently, right? That is a change that can be expected, and working through that with different arousal techniques, making sure pelvic floor is at its optimum, okay? Optimum being, if it's too tight, we loosen it. If it's too loose, we help strengthen it. But, and it's coordinated, because an erection requires coordination, right? Of your body to pull blood flow and have some muscles engage with an erection. So pelvic floor health is huge for our erections. That's, of course, given that you want to still have erections. If you don't, then this isn't that big of a concern for you. Drier skin, smaller pores, which is wonderful, right? You're thinking like, ooh, my pores get smaller. You can't see them through the screen. However, drier skin is something that can be possible. And so we don't want to find all the oils and serums and, start solving the problem that way. You want to find it very slowly, trying different things, but also dermatology might be an appropriate person for that. Body odor changes. Look, no one gets to escape body odor changes. Okay, hormones are hormones. Regardless of which side or where you are, hormones are going to change your body odor. And so being prepared for that. And then weight gain. So the redistribution of the weight, but then gaining weight also, right? So, and it may be faster than you typically had it, and it may look different. And it may be things that you're just like, I didn't even change the way I I was eating, but now your body is processing the food that you're putting into it a little bit differently. Okay. So let me know what questions or anything you have on hormones. I covered a good bit of stuff here with it because it's such a, let me see. Oh, okay. Oh, okay. Yes. Okay. So I do have a question here. So when taking hormones, can atrophy cause prolapse? So when we go back to, let me see if no, we went too far. Oh, there we go. So one of the things that can happen that I didn't say here on our trans masculine folks is that atrophy can happen. When we say atrophy, we mean decreasing in size and or opening of either the vaginal canal, and now this is anatomical female, so vaginal canal, or the tissues, so say labias, the lips, and things around. So atrophy can start to happen with that decreased estrogen in the body. Think of this as the same thing that may happen to folks who are going through menopause. And atrophy usually takes time, right? It has to be a prolonged amount of time of decreased exposure to estrogen before we start to see some atrophy, which is why we usually see it in folks who are a bit older. However, with the increase of testosterone, decrease in estrogen, we can start seeing it, but still, it does take some time. Okay. I'm saying it's going to take longer than a month. It's going to take longer than 5-6 months. It's going to take a decent amount of time. So prolapse can happen. It can happen quickly, but that does take time as well. So prolapse typically is not going to come from atrophy, right? What prolapse is the weakening or the loosening of organs within the pelvic floor. So if we're thinking of anatomical female, that could be the bladder is coming down, that could be the uterus is coming down, or the whole vaginal canal can come down, or the rectum can come up. So prolapse can happen in any of those ways. Typically, though, that's not because of atrophy, that decreased exposure to estrogen. It can decrease your support. What usually is caused by is improper pressure, right? So think of being constipated and you're pushing, you get those hemorrhoids. That can also increase prolapse, right? So if we have a lot of pressure over time, that can come from that. So I don't believe that prolapse can be caused from atrophy, which is, can be caused from hormone therapy. So thank you for that question. Okay, so now if there aren't any other questions, or if you're still thinking about some, I'm going to give you a big, wonderful thank you for being here, for allowing me to be in your space and share this content and information with you. I absolutely love it. Listen, I am just, anyway. So I want to thank you so much, but also thank you for being here for the people in your life. So whether that's a loved one, whether that's yourself, whether that's your patients, thank you for taking this information and taking it back to them, or, just taking it for yourself so that you can be an ally. Because you are here, I'm going to have my lovely assistant Kat drop the link for our consultation. So if there's anything, one, I didn't answer your question or I didn't get to it, this is a link for a 15-minute phone consultation, and it will be free. This is typically a $30 cost, so I'm only going to give you 48 hours. So I'm telling you, in 48 hours, you go to click that link, it's going to ask you for your credit card. So don't do that. Just do it now. Go ahead and schedule a consultation, okay? If you have any questions that you didn't get answered more specifically, or anything that applies directly to you that you need a resource for, definitely hit that link, okay? And then, of course, you can follow me on Instagram. I am your pelvic ally because I am an ally to all things pelvic, your hips, your back, your chest, everything. And if you have any questions that did not get addressed, you can put them, you can send them to info@rosepelvicphysio.com. And then you can always send us a text or a call. Okay. So thank you so much for being with us today. And I appreciate all that you're doing for the people around you. So I will see you later.